Attention now to our coverage of the second wave of COVID-19 in Nigeria. Well, the World Health Organization Regional Office says Africa is in danger of being left behind as countries in other regions strike bilateral deals to get access to safe and effective vaccines. This comes as Nigeria recorded more than 2,000 COVID-19 infections, the highest since the pandemic first hit the country last year. The COVAX initiative has raised $6 billion in pledges, but needs an additional $2.8 billion in 2021 to reach its target. And the World Health Organization is urging richer countries to contribute and help to end the pandemic globally. Our correspondent, Kemi Balogun, reports.
The World Health Organization says African countries are about 42% ready for their mass vaccination campaigns. This is an improvement from a starting point of 33% just 2 months ago. However, the World Health Body believes that there is still a long way to go in reaching the desired 80% benchmark for African nations. To further push this, 600 million doses have been provided by the coalition to vaccinate 20% of the population by the end of 2021. An initial 30 million doses of vaccines are expected to start arriving in countries by March, with the aim of covering at least 3% of the general African population. Of course, doses will prioritize mainly healthcare workers, the elderly, and those with pre-existing conditions. In Africa, Guinea is the only low-income country to provide vaccines, and only 25 people have been vaccinated. Nigeria's population of over 200 million continues to record high infections, with the highest number recorded on Thursday with close to 2,000 new infections. And the expectation is that the vaccines will save the day. But without proper adherence to set guidelines and protocols to keep the virus at bay, a second lockdown, although strongly discouraged, might just happen.
It's not unusual at all. It's part of normal quality assurance processes for laboratories. And the WHO actually doesn't even need to be that prescriptive. A good laboratory should be able to decide based on their own assay and assessments as to what is the best cutoff to use.
The World Health Organization has also set guidelines to laboratories testing for COVID-19 to reduce the circle count in PCR tests to get more accurate representation of COVID cases. But this medical expert says it is expected and nothing new.
It really depends on people. The public health measures that we have insisted for many months now for people to follow and respect, such as wearing of face masks in public spaces, such as washing of hands, such as keeping physical distance, such as avoiding mass gatherings. If we do them consistently, there won't be a lockdown. There will not be a lockdown at all, because the numbers will come down.
The COVAX Global Initiative brings together governments and manufacturers to ensure that COVID-19 vaccines reach those in greatest need. All 54 countries on the African continent have expressed interest in the facility. Kemi Balogun, TVC News, Abuja.